The number one thing you need to know is that addiction is treatable. One of the most common questions that I get asked as an addiction medicine specialist is, what treatment is there for addiction? Is it even worth it? Should we just give up? And absolutely, let me tell you, number one thing I want you to remember, addiction is treatable. It is absolutely treatable. Now, is it 100% that everybody is going to be, fixed in air quotes here? No. What happens is treatment is aimed at improving quality of life. Not unlike a lot of chronic illnesses, right? When we treat diabetes, we don't cure diabetes. What we do is we improve the life of the person with diabetes by controlling their blood sugar, helping them to reduce their weight, and doing all these things that then don't result in things like amputations or loss of sight or kidney problems. In addiction, it's no different. What we do is we treat somebody to be able to enjoy life in a way that's high quality, so that they're not injecting drugs, that they're not being impaired and then driving and then hurting themselves or somebody else, that they don't become impaired and then ruin relationships, that they're saying things that they didn't intend to say, because as you might have learned if you saw one of my other videos on what is addiction, addiction is a disease of the brain, and one of the parts that it affects is the centers around reward and judgment. And so sometimes we say and do things we didn't intend to do if you suffer from the disease of addiction. Treatment is pretty broad. It depends on how severe somebody is. It depends on the substance. There are a class of addictions that can be treated with medications. And then there's some addictions where medications aren't as primary, that they're more behavioral therapies. And almost always, the way I like to view treatment for addiction is that there's a medical component to it, there's a psychological component to it, and there's even a spiritual component to it. And I'm not talking about religion, I'm talking about even the spiritual part of just the oneness of a family. Because at the end of the day, addiction is about family. And treatment, at the core of treatment, is the community. And that community is that doctor, that therapist, the family member, the friend. That is the core of treatment.